Hello people, in this video let us look at this book, Manual of Clinical Cases in Ear, Nose, Throat, that is ENT by Dhingra and Dhingra. So basically this book is a companion to your textbook. I'm guessing this is coming free with your textbook. So let us look at this book now. Let's look inside. All treatment is in green, which is interesting, right? That's how it should be. Treatment should always be in green. Now, shall we look at the contents, people? Contents, so here they're talking about ear, nose, and obviously, next one is throat. Correct? Under throat, you have oropharynx, larynx, neck also, right? So, in ear, what and all are they covering? They're covering hearing tests, chronic suppurative otitis media. This is what is important for you for exam. Chronic suppurative otitis media, unable to color it. Let's try this color. Good old pencil is the best. Chronic suppurative otitis media. Very important for your exam. CSOM. Okay. Then cholesteatoma. Bell's palsy. So facial nerve. So you should know all this. Now coming to nose. Nose what, and you should have deviated nasal septum. Oh, pencil also is not good. Okay, got another pencil now. Ethmoidal polyps. Polyps, you should know. Antrochoanal polyp. Then rhinitis, septal perforation. Then that's what they will give in the exam mostly. What else is there here? Oral cavity, what can they give you? Juvenile angiofibroma and all is way too much, I think. Ranula, have you seen any case in your college? What else, guys? Larynx, what cases? Neck, usually neck they will give you, right? Neck, they can give you a lot of neck swellings of the neck. Thyroid nodule, is it? Now, in this book, what exactly are they trying to cover? They're not covering examination. How to examine ear, nose, throat. No, that's not what they're talking about. They're talking about individual cases, which will actually be useful for you. If you know the case that you have, on a high level, if you know what and all, what case it is, then you will know how to take the history. Okay, how will you examine this case, and what are the differentials for that case, and what is the treatment, what are the investigations, etc. I think this is a very nice book in one way. Like when you know the case, tomorrow they ask you to present CSOM case, then you will know how to present the CSOM case, isn't it? For everything, is there a differential? For this, they didn't give differential. Guys, focus. Did they give a differential for this one? CSOM? No. Examination they have given. Investigations, treatment, supplementaries. Okay. So look at this book. Cholesteatoma. Then Bell's palsy. Nose, deviated nasal septum. Then look at this. For polyps, what are the differentials, people, that they have given here? Ethmoidal carcinoma, it can be papilloma, it can be Churg-Strauss disease, Samter triad Young syndrome, cystic fibrosis by primary ciliary dyskinesia. Is it sounding undergraduate level? Treatment, steroids, etc. Montelukast, antihistamines, right? Leukotriene receptor blocking. So all this You can learn from this book. Frontoethmoidal mucocele. They've pointed an arrow here. How will you treat this? Will you give some antibiotics and wait? Treatment, they're actually suggesting surgery only. Marsupialization is the treatment of choice. Frontoethmoidectomy. That sounds like they're removing something and throwing it off. Frontoethmoidectomy. So guys, how are you finding this book? This is a very small but a very nice book, I feel. So let's flip some pages, and I think this book is very useful. What do you think, people? Occult primary. What is an occult primary? An occult or an unknown primary is defined as histological evidence of malignancy in cervical nodes, but with no apparent site of primary for these metastases. So they don't know from where it came, but it has come to the neck. Isn't it? Cervical nodes. How will you treat? If all the search for the primary tumor has not yielded result, then what will you do? Radiation to the neck. Neck dissection with radiation. Okay, to the suspected site. Branchial cyst. Have you seen branchial cyst, people? This is the branchial fistula. Second arc branchial fistula. They're exactly telling you which arc it's coming from also. This actually is kind of nice, isn't it? Differential diagnosis for branchial cyst. What can it be? Second branchial cleft, third branchial cleft, fourth arc cleft anomaly. Ooh. It's kind of hi-fi. Thyroglossal duct cyst. This I know. Isn't it, people? This we know. This and all you should know even for surgery. Neck swelling. Isn't it? So how do you think this book is, guys? What do you think? To me, it looks like a useful book. So just cases, not examination as such, overall ENT examination, but cases in which each case they have given the examination also, which I think is nice. So this is your manual of clinical cases in ENT. So for exam, I think this will be really useful. However, in this book, there are no Viva questions and answers. That part probably I can excuse, because treatment means you'll read the treatment here. Investigations means you'll read the investigations here. So I think it's kind of a useful book and very colorful. So that's the conclusion for now. Make your own decision. Bye-bye.